This is the neonatal intensive care unit at Fletcher Allen Healthcare. This is a very special bed that provides lots of features for caring for a very tiny and vulnerable population. Our nurse here, our NICU nurse Mindy, is going to show you a few of the features of the bed. Mindy, why don't we start out by showing how the baby could be weighed if we were going to do a weight on a baby without taking them off the bed.
Wonderful. So there's a lot of options listed up here. As you can see that we're able to scroll through. Allows us to do a lot of our care without having to mess with the little babies too much. So it would tell us to lift our little baby up, and it gets a baseline for the items in the bed. And then we place the baby back down, and it will give us a weight. So this little baby weighs 820 grams. It's very nice, especially because we don't have to take all of the linens and everything off. We can just weigh the baby as they are.
Great. Can you show us how you're able to have easy access to the baby with the sides of the giraffe bed going down?
Yes. Each side comes down. We could take all three sides down if we needed to. Sometimes we have to take this side down if we're doing special cares for the infants, if they're having something called an EEG that we have to access their heads and things like that, so that's a very nice feature. And there's also a button here that we can push when the top is down that changes the way the air circulates within the giraffe bed so that there are no drafts coming in and the temperature is maintained, the thermoregulation stays the same to keep the baby's right temperature.
Because temperature control for these babies is so critical.
Yeah.
Can you show us how the mattress is pulled out and the baby's able to be turned if needed?
Yeah, something that's very nice about these beds is that we can turn the mattresses within the bed without having to remove the babies. And something small like this is extraordinarily helpful for these teeny little guys. Sometimes we feet or their heads, and we need to move them in order to have the right angle and the right access. Their veins are very tiny and hard to put IVs in, and it's oftentimes very tricky to turn the infant themselves on the bed. Turning the whole bed is a lot easier. They oftentimes will have lots of lines and different things connected to them, and that can be very challenging. So being able to turn the bed like this is really important.
Great. And also, if you had to do an x-ray on a baby this tiny, isn't there a special feature on the bed that allows you to do that without ever moving the baby?
Exactly. Yet another way that we don't have to disturb the babies as much is there's a special tray on these beds that the x-ray technicians can place the film for the x-ray on here, and we can slide it underneath so that they can take the picture from the top and it registers on the film down below. If we did not have the little baby in the giraffe bed, we would have to lift the baby up like this and put the film right here. And oftentimes that's actually, in addition to the trouble of moving the baby, it's very uncomfortable. It's a hard square piece of film, and oftentimes if we're doing their chest, it ends right where their little heads are, and it's there's a lot of sensory stuff that's very unpleasant for these little guys about that. So having the little drawers is really wonderful as well.
That's great. And the bed does have a phototherapy light built into it also, correct?
Yes,
that's why
oftentimes babies who are in a typical isolette, we would have to order a special bank of phototherapy lights that sits next to the isolette. It's kind of cumbersome, it gets in the way, and we don't have much space here. These beds come with their own phototherapy light that we can just turn it on, and it will provide the right spectrum of light for these little guys, and it's right here on the bed. And
great.
They have the little baby sunglasses that they wear with these.
That's why we have the blinders on the baby, to protect them from the special light. That's terrific. So now that we consider the baby stable, can you just show us how the open bed would convert back to an isolette so that the baby would have an environment that's quieter and more conducive to resting for the baby?
Absolutely. So to close our giraffe warmer, there's a button that we push on the side, and the top goes right down and secures into place to maintain their neutral thermal environment. Eliminates sound and external stimulus that's that are not ideal for teeny guys to have.
Go ahead.
Hi, my name's Angela, and I'm one of the lactation consultants here at Fletcher Allen NICU. And I want to just tell you about our breast milk warmers. We used to use hot water, and the danger with that is there's a risk of infection, contamination from the water, and there's also inconsistent temperatures. You can have warm the milk so that it's dangerously hot and destroy some of the benefits, or that it's still too cool and that's bad for the baby in terms of digestion. So we've gone to these breast milk warmers, and we have a liner so that you're not contaminating between different patients, and you can either use bottles or you can warm syringes, which is what we largely use, and you close it up and you slide your syringe, your container with milk, and it's pretty easy. You set what you want, whether you want it to warm, or we also use this to thaw our breast milk so that we're not thawing too much. We want it just to be still cold and not warm it, which is a problem with using the water like we used to. And we can use this to warm formula as well as breast milk, so that our little babies are not having to expend calories to warm their food, and that way they grow better. So it's really important.
And the advantage is that it's consistency of temperature too,
right,
between
that's the
formula and breast milk also.
Right, and you're not, with the breast milk, you're not damaging it by having it too hot or too cold.
Right.
So, and then it will, it beeps at you and lets you know when it's the right temperature, and it will also, if you're busy with it for a few minutes, it will maintain it, continue to circulate air. So it's all a clean air system. There's no cross-contamination, and it's easy care and cleaning. And now that we have so many, we can use them for each individual patient.
Which is great for patient safety.
Yes.
And the risk of breast milk errors or feeding errors, correct?
Significant.
Yes. Perfect.
Huge safety issue.
Huge. All right. Well, thank you, Angela.